Hi, thanks for joining. Please make sure you subscribe to follow us on all the various platforms here on the podcast, as well as on YouTube. The stuff we write on Substack, as well as quick takes on Instagram and on Threads. If you're enjoying what we're putting out there, please make sure you're sharing with all your friends and family. And if you have questions or comments about the stuff we're putting out there, please make sure you leave them in comments to us. We'd be more than happy to cover them in future talks. I'm going to try my hardest not to make this into a political podcast, a political discussion, as relates to a lot of the misinformation and disinformation that is being spouted within the public health realm, within the health science realm, particularly from people who are in positions of power within the health agencies of the United States. Having that caveat out of the way, there is a lot of nonsense that's being spouted. There's a lot of nonsense being touted by people who are in positions of power overseeing our public health, overseeing our health sciences, that have led to a lot of resurgences of myths and misconceptions that have been disproven or have been shown to be untrue within the general population, where there may be some evidence to show that there is validity for use of some of the advice that's being given within specific populations and within specific conditions. Nonsense that gets picked up and published, leading to a lot of confusion that's out there. Whether in terms of the advice that we should be following, the advice that we should be disregarding, the advice that we should be ignoring. And so it leads us to needing to have a conversation about some of the myths and misconceptions that are out there and what we should be kind of holding on to without revisiting all of the previous discussions that we've had. Let's take a look at and let's discuss some of the nonsense that's being discussed within the public health realm as relates to some of the advice that's being given by people within positions of power in the United States as relates to our public health and our health science discussions.
Warning. The following presentation contains information that might contradict what you have previously heard, or believed to be true, about how the human body works, and contains material that is not suitable for closed-minded individuals. Enjoy.
So once again, I'm trying not to do this in terms of a political discussion. A lot of the talking points that are coming out of the Department of Health and Human Services about this need to quote unquote make America healthy again, the MAHA discussion that goes into play here, includes desires to change how Americans eat, how Americans exercise, how Americans live, with this desire to make people do things that they wouldn't normally do, where we have to kind of take a step back and once again, without getting into the politics of it or the monetary stuff in terms of what's being cut, what's being kept within budgets, the idea here is the first thing we have to kind of address is, has America ever really been healthy? And is the advice for diet and exercise that's being touted capable of making people healthy? And so to that first question, has America ever really been healthy? The obvious answer is who knows? There's a lot of historical documentation to support an answer of no. The rash of health sanitariums, the fad diets, the fad exercises, the unregulated supplements, the health tonics that have been hawked throughout the history of the country makes it very difficult to stipulate that America has ever been healthy. It's difficult to say that we've ever truly been healthy. As far as infectious and communicable diseases, we are actually doing a pretty good job if we can just get people to be vaccinated and stay vaccinated. And that's one of the issues that comes into play here as relates to this idea, once again, without trying to get into the politics of it, about the messages that are being sent as it relates to the ideas around being healthy and being healthy again, in terms of the ideas that the current political climate has in terms of statements. The idea that we have once been healthy and are no longer healthy it's really a confirmation bias more than an actual evidentiary statement. It's an idea that has led to talking points and to discussion points as it relates to the desire to try to find a a cause for a neurodevelopmental disease issue or neurodevelopmental issue, if you want to think about it in terms of disease or dysregulation factors that come into play. In terms of autism and autism spectrum disorder issues, the neurodivergent pathways that come into play, where the current head of HHS in the United States, Robert F. Kennedy Jr., wants us to somehow come up with the cause for the autism issues, particularly in terms of the epidemic rise that has been noted over the last 20 plus years. The rise that he wants to somehow link to something and has placed in charge of research people who have a specific slant in terms of their research instead of being good scientists and following the evidence where the evidence takes us. The timeline that has been stipulated within a lot of his talking points, once again, without getting political, doesn't make sense. The ideas about what the factors that he wants to point to doesn't make sense. The root cause for the neurodivergent issues that come into play when we start looking at autism is not necessarily a post-fetal exposure issues to some of the toxins that he's talking about, some of the environmental factors that he's talking about. It's more of a fetal developmental issue in terms of the issues that come into play. The fact that we want to look at and link to specific genes doesn't make sense given the number of genes that come into play. And it goes back to stuff that we've talked about as relates to the non-communicable disease issues and the fact that there is no single factor and only one factor that will be the root cause for something that is a multifactorial, highly complex, highly convoluted issue. And so within the political frame, once again, trying to stay away from the politics of this. Within the political frame, the idea that there are distinct causes that are attributed to environmental toxins, heavy metals, pesticides, filaments, those issues, yes, they can have developmental factor impact. But the developmental factor impact is going to act in terms of a genetic regulatory factor. Then that genetic regulatory factor will and can have an impact in terms of long-term activity and activations occurring in neurodevelopmental responses, and those neurodevelopmental responses leading to some of either the delays that we see in terms of neurodevelopment or the incomplete neuroanatomical structure development that has been associated with issues related to autism. And so if we look at some of the factors that are coming into play in terms of those environmental toxins, one of the things we have to look at is we have to look at, okay, what are the toxins and how are the toxins that are going to be listed in terms of these ideas, how are they going to impact the overall functions that are taking place within the developing brain? And it's going to impact it based off of either being a metabolic disruptor or impact it based off of being an endocrine disruptor. And without once again going into the hours of discussions that we've previously had about endocrine and metabolic disruptors, what those toxins are going to impact on is on the biochemistry taking place within the cells and those biochemical changes taking place within the cells leading to cellular anatomical changes, and those cellular anatomical changes leading to some of the neurodevelopmental issues that can be attributed to or seen in the autism spectrum disorder behaviors, the autism spectrum disorder issues, if you want to think about in terms of issues. But there's no single environmental toxin, there's no single environmental factor, there's no single metabolic disruptor, there's no single endocrine disruptor, there's no single gene that is going to be the single limiting cause to the development of the autism issues. Once again, we want to think about in terms of issues. The statements that are being spouted in terms of political talking points takes us away from the science that is there a lot of the attributes that we get in terms of this elevated level of diagnosing of autism, in terms of the rates that we see, where people are more concerned about the numbers, the 1 in 150, the 1 in 22, the 1 in 31, that get spouted out in terms of the odds ratios. It's an odds ratio. It's a relative risk assessment in terms of how likely is that to be seen within the population and the population as a whole, as opposed to what is the actual attributed impact that we see. Because of improved diagnostic techniques and because of improvements of awareness to the issues, a lot of the older verbiage, a lot of the older idioms, a lot of the older adages that we used to use for people who currently would have been diagnosed as being somewhere on the autism spectrum disorder, we no longer use. And so the elevated numbers that we see is really a ghost in the machine in terms, or a noise in the background in terms of the overall effects that we're looking at. And so if we look at the other terminology that used to be used, once again, without getting into the whole politics of everything, the older terminologies, the savant terminologies, where people had poor social interactions, that had poor cognitive scores in terms of IQ scores, but were able to do savant style things with other aspects of their cognitive abilities, they would have been scored within the autism spectrum disorder array based off of diagnosing that is currently being done versus what was done in the past. And so looking at this change in the odds ratios in terms of the numbers of diagnosing within a population, it's missing the point. It's not really a distraction, but it's looking at the noise within the data as opposed to looking at the data itself. And so when we start looking at this idea about that autism spectrum issue, we cannot stipulate that it is a single factor. We cannot stipulate that it is a double factor. We cannot stipulate it's a triple factor. It's a multifactorial issue. And because it's a multifactorial issue, we have to treat it like we treat all other multifactorial non-communicable diseases, which is it's something that comes about due to convergence and divergence melding up various impacts within the physiology of the developing brain that will lead to the autism issues that are seen. And the severity of those issues is based off of when those factors start interplaying with each other within the developmental sequence of the developing brain. And so we can't say, oh, it's just because of this or it's just because of that. And this is where a lot of people will get tied into some of the when do we see the symptoms and what has been exogenously added to the body. And this is where the post hoc agere prepara hoc logical fallacy comes into play. And if we're going to use that logical fallacy, as I teach all my students, we start looking at inductive and deductive reasoning within scientific principles and in the development of experimentations and explaining results within the experimentations. If I make a logical fallacy, regardless of how good my argument is, I have to ignore the argument because it's grounded in a logical fallacy. And so a lot of the discussion as it relates to the vaccine issues and autism, and when do we see the behavioral responses associated with autism as it relates to the scheduling for infant and childhood vaccinations, it's a post hoc agere prepara hoc logical fallacy in terms of the association. And once again, it's an association. It's not a cause and effect. There is an associated effect. However, if we look at the associated effects of everything, there is a greater associated effect to consuming organic foods and the elevated incidence rates of autism than there is to the vaccines that autism and the anti-vaxxers within the autism argument like to point to. And that idea about organic foods is going to take us to another kind of discussion point that's coming into play as it relates to some of the talking points in terms of the foods and what we should be eating and lifestyle factors. And this goes into that kind of second question that we're going to look at here in terms of, can diet and exercise actually make us healthy? And everybody wants the simple answer to be yes. We can absolutely use exercise. We can absolutely use diet as a medicine intervention to make us healthy. But the problem is, if we actually delve into the data, if we actually delve into the studies, the answer is more of a well, maybe. And the reason why it's a well, maybe is because we have to understand that our health comes from a wide range of factors that will all interact with each other in order to build and generate health. And because we're coming from multifactorial issues again, we have to look at where within all of those factors, diet and exercise are going to have an impact. And this is where we start talking about issues of lifestyle and lifestyle factors. And if we start looking at the medical literature, we have a lot of limited control for how we have confounds impacting our lifestyle factor studies. And this means it's very difficult to make a definitive conclusion that specific lifestyle interventions are going to be a causal relationship to having some sort of positive outcome, some sort of change in overall health. We then have to worry about other factors coming into play. And the biggest factor coming into play is the bias in our selection of information, where we tend to conflate the finding of single studies into justification for using a specific diet or following a specific exercise program, even if it may not be the best. It simply is the one that we prefer. And this is where I constantly reminding my students, constantly reminding my colleagues as it relates to the idea about what is best, what is preferred, and whether or not something has an effect or not. Everything has an effect. Everything is effective. But that doesn't mean that everything is equally effective or equally efficient. This idea about the fact that everything has an effect, everything is effective, is something that gets exploited within the ideas that get put forth by people within positions of power, by people who follow pseudoscientific principles, by people who utilize a biased approach to information selection, a biased approach to information recommendation, a biased approach to modeling of behaviors. And because of this ideas that will get exploited in terms of the fact that, yes, everything has an effect, everything is effective. This is where we have to take a step back and look at the literature that's out there, look at the research that's out there, and look in particular at the meta-analytical studies that are out there in terms of looking at what is actually effective and what is actually efficient in terms of being both effective as well as having high efficacy to providing the responses that are necessary in order to allow for health improvements. If we start looking at this idea about lifestyle diseases, this idea about diet and exercise in terms of becoming a means by which we're able to make ourselves healthier, what we have to do is we have to take a step back and remember and recognize, this is something that we've talked about in a number of the discussions, is that diet and exercise can only function to improve health by preventing or reducing the relative risk for the non-communicable diseases. Those are the diseases that cannot be passed from individuals to individuals, and tend to work better at prevention of a disease than at a treatment once the issues have started to develop. Yes, we can reverse some of the symptoms of diseases through diet and exercise. Yes, we can improve the efficacy of pharmacological treatments. Yes, we can improve the efficacy of other medical treatments through the use of diet and exercise. But diet and exercise by itself, unless the diet and exercise is done in a holistic approach where we utilize high self-selective, high self-monitoring behaviors that the individual wants to do without the feeling of coercion, you're not going to see overall improvements. it's a premise that is less understood than we want it to be. And it's a premise that's less understood for the simple fact that those who are less active, those who tend to be more prone to overfatness issues, inflammation issues, the associated lifestyle diseases issues, those people, if we start to change diet and exercise habits, we start seeing reversal of the symptoms. And because we start seeing reversal of the symptoms, we make the association that it's the lifestyle interventions that's causing a curative effect that comes into play. It's similar to the premise that we need vitamins in order to prevent stuff because we see what lack of vitamins do in terms of causing stuff. And once again, it's not necessarily a logical fallacy, but it is an incorrect means of rationalizing, an incorrect means of analyzing what the data is actually telling us. And so what this means is that while some individuals might say we need better nutrition to prevent disease, while others might say we need better nutrition in order to prevent infections from spreading, there's not really a scientifically valid rationale to support that opinion. And this is one of the opinions that has come into a context more recently, particularly if we start looking at some of the news coming out, particularly in the United States, in terms of the current epidemic spread of measles, where there's been a lot of media noise about vitamin A and the stipulated means that it might have in terms of stopping infectious disease outbreaks. But while we know that vitamin A is important for our health, a lot of the information that we have about vitamin A surrounding this idea about blocking or inhibiting or stopping this disease outbreak is not as well supported as the proponents might want us to believe. And so vitamin A, just like other vitamins, is an essential nutrient for normal metabolic processes. Vitamin A is specifically, it's a metabolite that is called a retinoid. And there are three primary forms of vitamin A. There's retinol, there's retinol, and there's retinic acid. And the idea behind this is basically in terms of the difference between retinol, and retinic acid is simply how is the metabolite formed. In this, we can convert some molecules into that vitamin A, and those are usually referred to as the proretinoids. And a lot of those we get from our diet. A lot of those things we'll get in terms of things that we eat. And the problem with that is that we need to have the appropriate amount of vitamin A. And this is where, once again, when we talk about stuff within the physiology stuff, we talk about everything being baby bear here, everything being just right. We don't want to have too much. We don't have too little. We want to have just right. And that's especially important when we start looking at vitamins like vitamin A, which is what's referred to as a fat-soluble vitamin. The fat-soluble vitamins, vitamin A, vitamin D, vitamin K, vitamin E, are vitamins that we hold on to because they will stay within the body. Some of these vitamins we can produce. Vitamin D, vitamin K are examples of vitamins that are produced. Other vitamins that are the fat-soluble vitamins we have to eat, like vitamin A, vitamin E, we either have to consume them or we have to consume chemicals that will become those vitamins. And for vitamin A, this is where we start talking about like beta carotene or the carotenoids in terms of the retinoid stuff that we are going to be consuming within our diet. And the primary sources of those retinoids in our diet come from either eating meat or eating fortified foods. Yes, we can get it from some vegetables. Yes, we can get it from some fruits, some nuts, some seeds. But the majority of vitamin A that we're going to be getting from our diet is going to come from the fortified foods that we eat and from eating meat. We can get a lot of the precursors in the vegetables that we're eating. A lot of the carotenoids that we can get from some of the fruits and vegetables that we get, such as like the sweet potatoes and the squashes and the kales and the greens and the carrots and the bell peppers and the spinaches and the lettuces. Those things, yes, we can get some of the precursors to vitamin A. And yes, we do need to have enough vitamin A within our diet in order to have enough vitamin A in order to do what we need vitamin A to do. And there is some evidence, and once again, this goes back to the idea about in certain populations and in certain conditions, there is evidence to say that the addition of vitamin A can be of benefit. And this is where we start looking at, particularly for that infectious disease idea, where a couple of studies indicated that for children who have a higher than normal likelihood to be exposed to a highly transmissible disease, in the case of measles is an excessively highly transmissible disease, the consumption of vitamin A helped combat the spread of that infectious disease. But there's a caveat here, and it's the caveat that is generally not discussed when people say, oh, use vitamin A within the treatment. And the caveat here is that the studies were done in areas where there was an insufficient level of vitamin A within the diet already, which means that the children were already prone to being vitamin A deficient. And this is where we get into the idea about supplementations and whether supplements are effective or not. And supplements, by definition, are things that are supplementing our diet, which means that I'm already not getting enough of it to start with, which means that adding to my diet is going to have a benefit to it. In the case of the children who were getting the supplemental dosage of vitamin A, there was a reduction in the spread of the measles. And once again, this is because the population was malnourished. And individuals who are malnourished already have a higher likelihood of transmitting diseases because they are malnourished. There is also within that same malnourished idea, there is some evidence to support the reduced impact on the retina within the eye in terms of the measles impact on retina function of the eyes. And that's because the vitamin A has an impact, the beta carotene has an impact on the physiology of the cells within the retina. It's one of the reasons why we need to have vitamin A in our diet. But that doesn't qualify for the individuals to indicate that using vitamin A is going to be a treatment for reducing the spread of measles or as a treatment for measles itself. It's not preventative. Vitamin A does not keep people from getting the measles, nor does it prevent measles from being spread. It's not a substitute for the measles vaccine, regardless of what people are telling you, and regardless of what people with microphones are saying, regardless of what people in positions of power are saying. This is where we have to be very careful and not fall prey to that. If we need it in certain conditions, we must need it in all conditions. This is also where we have to be very careful because vitamin A will accumulate within the body and can become toxic very quickly. And this is once again we have to not fall prey to the adage of if a little is good, a lot must be better type of thinking. that we tend to use when we start talking about nutrients and dietary supplements. Because vitamin A is going to accumulate, it's going to very easily become toxic, and vitamin A toxicity is actually worse than what we think about in terms of some of the ideas around toxicities. And it's usually something that is not discussed when we start looking at this idea about vitamin A supplementation. So one of the things that we start looking at is people with vitamin A toxicity. We're going to start seeing things like vision issues, nausea issues, dizziness issues, coordination issues. We may end up having issues of lethargy coming into play, issues of muscle and joint pain. But more importantly, we're going to start seeing issues within the liver. And that becomes problematic because we need the liver in order to detoxify the body in terms of eliminating any metabolic toxins, whether they are within the body, toxins being produced through normal metabolic processes, such as things that we have to excrete, or whether they're toxins that come in with the foods that we are eating. And this is where we want to make sure we are not accumulating greater than the 3,000 microgram equivalencies per day of the vitamin A. And so when we start looking at some of these ideas about things that we hear about, things that we see, things that get talked about in terms of this idea around making America healthy, and the ideas about, well, if stuff works in some populations, it must work in all populations. This is where we have to be very careful about that pseudoscientific approach that is being kind of spearheaded within a lot of the public health discussions, both within social media groupings as well as now within the mass media groupings, because of people who are given permission to speak as having positions of power. And once again, it goes back to this idea about, can we actually make America healthy again? And was America ever healthy again? And once again, this goes back into looking at the ideas around some of the diet, some of the nutrition stuff. And one of the things that it's one of the things that we've been talking about. It's one of the things that was put forward in the Dogmatic Diets book as relates to this kind of general idea about what I think is best versus what is actually best. And this ideas that we have in terms of, well, if there is this chemical that's found in something, and that chemical has been shown to have some sort of disadvantageous effect on metabolism, then I should avoid that at all costs in terms of consumption of the foods. And this has led to, once again, people who are in positions of power touting the consumption of specific types of macronutrients, in the case here, looking at fats, and the avoidance of some fats because they may have the potential to contain metabolic disruptors, or what's simply referred to as anti-nutrients within them, or where they may have an impact on our ratios of omega-6s to omega-3s. And this is where we hear a lot about the proponents for using tallow as the primary cooking fats, as opposed to using the seed oils or the vegetable oils that are readily available, where the idea about using rendered fats as cooking oils is going to allow for a better fat to come into play, as opposed to using the seed oil or the nut oil that is more readily used as it relates to particularly the mass-produced, mass-marketed fast food style cooking that we tend to consume if we're looking at eating out at restaurants. And a lot of the individuals will point to the once again association between the increased dietary intake of fast food using cooking with these oils, these seed oils, these vegetable oils, and the rise of overfatness within the population, rise of what are referred to as obesity within the population. that they want to point to as the fats being the root cause of the issue, and not the various metabolic disruptors, the various food preservatives, the various food dyes that we see within the foods that are being consumed. And once again, this is where we start looking at this whole multifactorial effect coming into play as it relates to the ideas that are being spouted. There is some evidence that, once again, there is some evidence to support their position. However, the evidence that we have to support the position is limited at best. And because it's limited at best, we cannot make the generalizations that they want us to make. We cannot make and support the claims that they want us to make and support in terms of this idea that using tallow is going to be better than using the seed oil or better than using the vegetable oil in the cooking process. And because we cannot make that claim, we cannot support the ideas about cooking strictly with the animal fats. There is some evidence to support the increased consumption of some saturated fats within the diet, but only in given populations and only in given scenarios where we see changes in other macronutrient quantities and macronutrient qualities. When we start looking at this idea about the unsaturated fats, one of the things we have to remember is that we have to keep a ratio of omega-6s to omega-3s within the fats so that we do not trigger inflammatory responses due to an imbalance of omega-6s and omega-3s. This is where we have to remember the omega-3s are going to be the essential fatty acids that are necessary in order to regulate inflammatory responses. These are the essential fatty acids that are going to be involved with cell membrane maintenances. These are the essential fatty acids that are going to be involved with hormone productions. In particular, hormone productions that are associated with inflammation and immune responses. And so the omega-3s are the ones that we tend to think about when we start talking about the quote-unquote heart healthy fats that are there, where we want to make sure that we have that 6-to-1, 4-to-1 ratio of omega-6s to omega-3s, where if we're going to increase our fat intake, we want to make sure that those ratios stay the same. Now we start looking at it in terms of metabolism and energy, which is what everybody likes to talk about when they talk about metabolism, is simply off of the energy idea as opposed to the actual idea about what metabolism really is. If we look at it strictly off of the energy issues for metabolism, this is where we have to take a step back and remember that in order to use the fats for energy purposes, we have to use the saturated fats. And this is where saturated fats within the diet become important, because we need saturated fats in the diet. We need saturated fats in the diet for energetic purposes, but also for all of the other things that we use fats for within the body. And this is where we start talking about fats within the diet. People will start almost immediately discussing the fact that, well, if I have fats in my diet, it's going to make me fat. And that's not how fats work. And this goes into some of the other premises that we have in terms of that lifestyle disease issue, where the premise about diet as medicine leads to the premise that there is exercise as medicine. Once again, we've discussed this at length in a couple of the other discussions. And just like with the idea about the dogmatic diets, we also have dogmatic exercise ideas that come into play that are going to cloud the idea about what we want to discuss and how we want to discuss it. That can and does kind of shroud the actual validity to some of the recommendations that get made. There is a general premise about physical activity that lead to the general recommendations that are made that is different than the recommendations for exercise. And this is where we get kind of mixed messages, and that mixed messages leads to general confusion at times. The premise about the recommendations come about mainly because we see people who are physically active tend to have better health outcomes than people who are less physically active. And this idea about physical activity is not based on the type, the intensity, or the volume of a distinct type of exercise, but simply off of being physically active. This is where we get that general recommendation, that vague recommendation of 30 minutes of moderate to vigorous activity, or 60 minutes of activity, whether we're talking about adults or children, respectively. The recommendation is about physical activity, not specifically about exercise. And physical activity is not exercise, even though exercise is physical activity. And this goes back to something that we've talked about previously and something that I've written about extensively. And that's the idea that everything will work. It's just how well will that work? The effectiveness of causing changes is highly variable based off of the type of exercise that's being used and the fact that the responses are not going to be equal. And that idea about high variability and inequality in responses leads to a lot of disagreement within the health and exercise community that leads to a confusion within the general population because the health and exercise community is confusing the health professionals, the medical professionals who are not embedded within the health and exercise community. And this is where we get some of that confusion, leads to very poor attrition within a lot of the recommendations that are being made as relates to what we should be able to get from exercise or what we should be able to get from diet as relates to improvements of health. And this is where we have to have the following always be true in order for us to be able to recognize having long-term success coming about. And this is where we have to make sure that we get a response that leads to improved function, followed by a reduction in the disease. The second thing we have to be able to do is we have to be able to stipulate a dose response. And that dose response either has to be based on exposure to or due to a time course that leads to alleviation of the disease through improvements in function. There has to be a method of application that is going to be provided to the person to have it be allowed to be a treatment. And this goes into a lot of what we talked about, a lot of what we've written about in terms of periodization. This is where the way in which we respond to a stress, the way in which we respond to a stimulus, because it's highly variable and because of the fact that we get differences in responses, means that we have to look at how does the application of the treatment impact the responses that we get from the treatment. And we have a physiological principle at play here, and that is the SAID principle, specific adaptations to impose demands. And that idea about the SAID principle means that we have to periodize what we're doing within the application in order to ensure that we are constantly being able to provide a treatment response. That treatment response has to have a relative effect for improvement from doing the treatment versus doing either nothing or doing what has been the long-held gold standard for treatment. And that long-held gold standard for treatment has to change based off of new evidence. And this is where a lot of the individuals within the public health realm, within the political realm, within the community realm wants to hold on to what they want to be the gold standard as opposed to what is the gold standard. And that gold standard is constantly changing. And one of the things that has changed recently that we've been talking about for the last about half decade now is the fact that in order for it to be effective, particularly for long-term effectiveness, the program or the plan has to have a self-selective choice within it. That is, you cannot have this implementation be done under coercion. Even if we have limitations in meeting all of those factors, even in terms of being able to develop a lifestyle intervention in order to make everybody healthy again, we have to know that dose response exists for the exercise or for the nutritional modification to be true. And we know that dose responses exist for nutrition, not based off of caloric balance, even though everyone wants to talk about it in terms of calories, but off of nutrient load, both in terms of a macronutrient and a micronutrient. And this is back to something we talked about in a couple episodes ago in terms of that idea about balance and the idea about balanced diet. And the fact that balanced diet is going to allow me to have that appropriate dose response for what I'm trying to get. Now, when we start looking at the dose response for exercise, we do know, once again, that there is a dose response for both resistance as well as endurance exercise. And that dose response that we get is based off of the FIT principle, FITT. And that's that frequency, intensity, and time ideas that come into play as relates to the American College of Sports Medicine's recommendations for exercise. Where the idea here is that if we are going to follow a specific type or pattern of exercise, that dose response will continue only if we continue to have a progressive pattern of stress. And this is where we have to functionally have adaptations taking place. And those functional adaptations have plateaus taking place within them. And this is where we have to remember that we have a window of time of 8 to 12 weeks, where we were going to see continuous progress and continuous progression over an 8 to 12 week window of time, where we will start seeing plateauing taking place in 8 to 12 weeks, where we have to start to think about how we can go about changing the stressors of the exercise, the stressors of the diet, so as to allow for continuous adaptations, and those continuous adaptations to allow for continuous improvements in health. If we do not make changes, this is where we will start interacting with various inflammatory responses within the body, regardless of what we want to do, where we will start seeing overtraining issues coming into play. And so we start looking at this idea about how we can go about being healthy, how we can go about being better in terms of our overall recommendations being made. One of the things we have to look at in terms of the recommendations that are coming out is, are they grounded in scientific principles, or are they grounded in pseudoscientific wants? Am I making my arguments off of logical analysis, or am I making my arguments off of logical fallacies? And the more logical arguments we can make, the fewer assumptions that we need in order to show a proof, the fewer steps within the analysis to get to where we need to get to in terms of showing that we have this outcome that is the indicated outcome, the better the response we happen to have. And so when we start looking at a lot of the stories that are coming out, and we start looking at a lot of the ideas that are being put forth in terms of the ideas about how we can go about having a healthier public, how we can go about limiting exposure to toxins, how we can go about limiting exposures to environmental factors that have a known impact on metabolism, and by having a known impact on metabolism, can have a known impact on our overall health. Because if we have a disruption in metabolism, that disruption in metabolism will lead to a disruption in our hormonal feedback loops, and the disruption in hormonal feedback loops can lead to a dysregulation of overall function, and the dysregulated overall function will lead to the diseases that we're trying to prevent. If we're looking at it in terms of trying to prevent communicable diseases, this is where we have to look at the steps that we can do to limit spread within the population, as well as look at preventative measures that we can do in order to reduce the likelihood of becoming infected, such as using vaccines, using appropriate hygiene. If we're looking at it in terms of the ideas around body composition and health, which once again leads to biases that we've talked about previously, and will lead to other biases that we have to worry about in terms of treatment from the healthcare professional, as well as seeking treatment of the healthcare professional. What we have to look at in terms of that body compositional idea is that, yes, diet and exercise will have an impact on it, but what the person's body weight happens to be, what the person's body composition happens to be, is not the equivalent of their overall health. What the person looks like does not equal what the person's health happens to be. We want to make it so, but it is not so. Well, thanks for listening. Hopefully got a little bit out of the discussion here. A couple of points of of thought for you to have. If you have other thoughts or other things that you'd like us to discuss, please make sure you're leaving those for us in the comments. We're more than happy to discuss them at length. Once again, we wanted to keep this as apolitical as possible. Yes, there is some political slants and political statements that have been made, and we're trying not to be excessively political in those ideas. We're simply wanting to present the science and the public health ideas that are out there, so that we're able to better understand and be better able to cut through the misinformation and disinformation that's out there. If you're liking what we're putting out there, please make sure you give us that big 5-star, give us that thumbs up rating, let us know that we're doing a good job. Please make sure you're sharing out with your friends and your family. Please make sure you're following us here on the podcast, as well as on YouTube, the written stuff in Substack, as well as the quick takes that we post onto Instagram and onto Threads. Stay tuned for more discussions on ideas as it relates to the misinformation and disinformation and combating those misinformations and disinformations, as well as how we can go about using our scientific understanding of how the human body works in order to be healthier.